Make lifestyle choices to enhance your well being. This is Natural Inspirations. You are listening to Natural Inspirations Podcast, the show where we have conversations with local natural health experts on the Space and Treasure Coast. Welcome to episode 43. I'm Chris Urquhart. Today we're talking to Dr. Yale Smith about what causes erectile dysfunction and the good news, natural approaches to resolve it.
So, when it comes to medical care, men are less likely to seek care than women. And while men may avoid typically seeing their healthcare provider, there are some problems that may prompt men to take action. And one complaint that can bring a man to a doctor's office is erectile dysfunction. So here today to discuss this with me is Dr. Yale Smith from the Center of Anti-Aging, Aesthetic, and Rejuvenation Medicine. Thank you so much for joining me today, Dr. Smith.
Thanks for having me again in your podcast, Zoom call, meeting. Pleasure to be with you.
Glad to have you. So let's just jump right in and let you explain to us what exactly is erectile dysfunction.
Erectile dysfunction is when a man has the inability to obtain or maintain an erection for penetration and during normal sexual activity, and also for having a satisfying sexual experience. Most men are very shy about discussing this, about manhood, and they won't seek medical help. They rather take a pill or just avoid it.
Understandable. So is loss of erectile function a normal process of aging?
It is. As men get older, the hormones drop, the testosterone drops, but that is not the main reason for ED. The main reason is poor blood flow. As we get older, we find that from various things, and I'll list those, that men have decreased blood flow in the penile tissue. One of the earliest indications of cardiovascular disease in men is ED. It is a normal process of aging, but there are various risk factors that men should be aware of. And these include a low nitric oxide level, low testosterone, cardiovascular disease. Diabetes is a big problem. Poor diet, poor sleep, a lot of stress, that their hormones are off, that they have Peyronie's disease, and you see that on TV. It's that the penis is bent. Men that have hypertension or on blood pressure medications. Men that unfortunately are using drugs, either prescribed or unprescribed. Abnormal lipids, stressors, if they're with COVID, what's going on, losing their job or can't pay the bills. These all impact a man's performance in the bedroom. Patients that are hypothyroid is the big thing that's not checked. These are some of the big things that we need to check for patients.
So you've listed quite a number of things there. So this sounds like it might be a fairly common condition. Is that true?
1/3 of men now suffer from ED.
Yeah, that's a significant number. And so with all of those underlying health conditions that can be related, are there things that can be done to preventatively for ED, or that, other recommendations?
Well, any patient that comes in with that, we have to do a deep dive on their physiology. A lot of times, it's not just low T. That's only 20%. It's flow. They need flow. Mm-hmm. And so we need to do elaborate testing on them to check for lipids, the blood sugar, the testosterone, the thyroid. All these things impact this. It's not just one thing. And once we find what the initial thing is and we start treating it, they start feeling better. And then there are treatments that can be done. You can increase nitric oxide by checking a lab value on them to see how much ADMA and SDMA is made in the bloodstream. This is for causes blood vessels to relax. Inflammation is a big thing. If they're diabetic, we have to get that under control because these patients not only develop plaque in their vessels, they have problems with sensation. Patients, and as a side note, diabetics who have cardiovascular events may not have chest pain because the nerves are damaged to send that pain receptor. They may become diaphoretic, which they sweat, or they just don't feel well. So all these things need to be looked at before you start treating them with ED.
As a functional medicine doctor, you have, this approach is not just for ED. I mean, this is something that you work with every day. So you have a lot of tools in your toolbox, don't you, for recommendations to not just help with ED, but also all of these other health conditions.
Yes, we do. We look at everything from sleep problems to, patients can be exposed to a toxic mold and don't even know it, or what they call MARCONS, which stands for multibiotic antibiotic resistant negative staph in their nares, where they have these biofilms, these bubbles full of parasites and bacteria and viruses that release toxins into your body, into your brain, and just with mold, it can mess up their neurotransmitters and their hormones, and they don't even realize it.
Right.
So we look at all these different things, and most men will see someone and they're just giving testosterone without finding the root cause. We look at everything, and if their testosterone is low, we look at why is it low, and we try to fix that problem so that testosterone normalizes on its own. It's not just giving testosterone, because once you give that, it tells your brain, you don't need to make any more. We rather the body make its own and find the root cause.
Right. You don't want to shut off the production of testosterone. So we know there's pills for ED. So what are some of the common treatments? I mean, you've already acknowledged that you're going to look at the overall health and the underlying conditions to help with the blood flow and the other supportive functions that you need to turn ED around. But, pills, and what are some of the common treatments for ED?
So the most common is a phosphodiesterase type 5 inhibitor, which causes your blood pressure to drop. It's not really good in older men who have cardiovascular issues, where it's like taking a nitroglycerin. It'll dilate them and drop their blood pressure, and they can have a cardiac event. And that's why cardiologists say be very careful of taking this medicine when you want to do hypertensive, because it can worsen the effects. There's another thing called prostaglandin E injections, which I don't know a lot of men that want to take alprostitol and inject it into the penis so they can have an erection.
Right.
We can use a pump device to cause engorgement into the penile tissue to enlarge it. But you have to do on blood thinners. You have to be very careful, because it could cause trauma and hematomas, and you can end up in the emergency room and have to go to surgery. There's something new called acoustic pressure wave therapy. It's been around in Europe and recently brought over to the US. What it uses is sound waves and pressure that's applied to the penile tissue And what it does is it sends these sound waves, high frequency sound waves, into the penile tissue and surrounding tissue. And it's had amazing results in about 70 to 80% of the patients. What it does is it increases angiogenesis or neovascularization, that's new blood flow into the penile tissue. It breaks up plaque, microplaque in the blood vessels, so you have more flow. It creates new nerve growth factors in the penile tissue, so there's more sensation. It prolongs a man's erection. It increases the strength of the orgasm. And from what I understand from speaking to patients, it gives a more pronounced sensation during orgasm. So it's non-invasive. The procedure takes about 20 minutes, twice a week, for anywhere from 3 weeks to 6 weeks. And a patient comes in and we give them a cream, a local anesthetic cream that they apply about 30 minutes before the procedure. They come in, they go into the procedure room, and then this machine is used and it sends pulse waves through. They may feel some discomfort, but that's okay because then we know it's working, but virtually no pain. And then after the procedure, they go home and we tell them to use it because you want to have an erection and get blood flow in there and help break up plaque. And this procedure works so well that when I was in training to do this, I was told that a lot of the performers use this. They come in routinely for this. And I looked at the nurse and I said, listen, I don't live down here. I don't know what the hell goes on down here, but I don't live down here. What are you talking about? And she said, do you know what I mean? I said, no, I didn't mean it. She said, the porn stars, they come in on a routine basis because this is their business.
Right. So apparently that's a pretty good recommendation or a testimonial.
Yeah. And this is done, now it's very, very commonly done all over the country and all, in Europe.
So if a man undergoes these treatments, and you said it could be 3 to 6 weeks, do you expect, I guess if they don't change their lifestyle, plaque could reaccumulate and they may have to come back, or what's the opinion?
What we try to do is we follow them with their total health. So if their blood sugar is very high, we want to get that under control. If their lipids are abnormal, we want to get that under control with generally natural treatments. Mm-hmm. And we want to treat the ED. Right. To get their blood sugar under control, there's less likely of plaque and less damage to the blood vessels and more sensation with the nerves are not being damaged. So it's a complete thing. It's just not one, like what you see on TV, you have ED, okay, you have low T. Right. That's not accurate. Only 20% of men have low T. And there's ways to treat that. And the ways are you can change their diet, exercising, excuse me, resistance and aerobics will increase testosterone. But everybody goes to this give and tea. Well, most men don't need that, especially younger men in their 30s. You can give them a drug called Clomid, which tells the brain to make their own testosterone. And we trial that for about 8 weeks to see what their testosterone levels are and how they're feeling. And then we repeat the lab work, and if it's going up, we continue. If that doesn't work, then we would go to other things like, a cream or an injection. I don't do pellets. I don't believe in them. Mm-hmm. once you put a pellet in, it's a surgical
It's
procedure,
Yeah.
you can't get them out.
Right.
So we're trying to titrate all these things for their own individual physiology.
Well, it sounds like a win-win then. I mean, if a man, that's maybe his first sign that something's wrong is symptoms of ED, but you have a whole health way of approaching it and getting him back on track, as well as a strategy for some immediate support with the APWT, the pressure wave therapy. So I think it's all good news. I think everything you've had to say is really good news for men who maybe aren't concerned about ED as a problem for them.
They just need to realize it and bite the bullet and accept it and realize that there's an issue and they need to come in and fix it.
Yeah, come in and fix it. Well, thank you so much for sharing your expertise with us today. I really appreciate your time.
Thanks so much.
And everyone, be well, stay connected.